One of the most common things I see in my practice are patients who come in with one of two problems. Doc, I can't breathe. I can't breathe. I snore, and I don't like the way my nose looks. What we're talking about is septorhinoplasty, correction of nasal defects. It's a very common problem because we see a lot of athletes, we see a lot of people both congenitally and through trauma who get damage to their nose. Let's talk about the approaches to rhinoplastic surgery. The septum is the midline, and people have always heard about, I have a deviated septum. Well, that septum should be in the midline between both of your nostrils. If it's pushed one way or the other, obstructing one of those nostrils, you have a deviated septum. And what are the ramifications of that? Well, I exercise and I can't breathe. I snore. People tell me that they can't understand what I'm talking about sometimes because I talk nasally. In that case, what we're doing is what we're called a septoplasty. A septoplasty is simply repositioning that septum from being crooked to being back in the midline in what we call the vomer groove. And how is that done? Well, basically a patient is either done under sedation or sleep and general anesthesia. We generally numb the nose up with a liquid type of material, usually a liquid cocaine, to be able to numb up the area of the nose to decrease the amount of bleeding. And then what we do is literally excise the area of the covering to the septum, which is called the mucosa, and literally score it, almost like you'd shred paper, to be able to place that back in the midline. If it's a severe deviation, you can actually take out a portion of that septum and use it to be able to push it back over on the midline. In correcting that, what you do then is open up the airway passage. For your own benefit, a lot of this time, depending upon the much of deviation, insurances will pay for septoplasties if it affects your breathing time. Now, if you don't look good, if you come in and you got a nose with a hump that just won't quit, if you got nostrils that are too wide, if you got a ski nose deformity, then this is something that really won't be covered by insurance, and it's called cosmetic rhinoplasty. One of the chief complaints that we see is because of different ethnicities is a hump on my nose. Doc, I don't like this. It makes me look older. It makes me look like a hawk. What do I do? Well, basically, a hump on the nose is usually a bump, either on the bone or on top of the septum. And literally what we do is sculpt the nose. By going through incisions inside the nose, we literally go to the hump and actually trim it away. File it down, almost like you're using a nail file or taking away a little bit of the top of the hump itself to be able to flatten the nose out. A ski nose deformity is different. Instead of an upswing to the nose, it's a cavity, it's a valley. In those cases, we can actually take that little septal cartilage that we talked about or separate implants and actually put it as a scaffolding over top of the valley itself to be able to flatten out the nose. Now, what if you look in the mirror and you say, man, my nostrils are this big? You know, some of the older people will remember W.C. Fields. We had a real big, thick cartilage at the lower portion of his nose. As plastic surgeons, as cosmetic surgeons, what we do is actually sculpt that cartilage. We actually take away what's called the cephalic portion, the top portion. It looks like a little gull wing, and we're taking away the top portion to be able to shape and change the shape of the nose in any way we want. By taking out cartilage, by rearranging cartilage on the tip of the nose, it's like chicken gristle. By taking that out, we're actually able to sculpt and change whatever shape we want to the area of the tip of the nose. Nasal surgery can also involve wide nostrils, nostrils that look too wide, like tunnels going through a city, like in Pittsburgh through the Squirrel Hill tunnels, where they're wide and diverted like that. In those cases, what we do is actually what we call weir excisions, incisions on the skin to rotate the nostril in to make it look smaller. Nasal surgery is done as an outpatient. The patient generally may or may not have some packing or some filling in their nose to decrease the bleeding and to hold the septum in the midline. And a little splint, a plastic splint or a plaster splint on top of the nose to hold everything in position. Now, once again, you want to know from your surgeon, what are your qualifications? How many of these have you done? And what are the complications that I can see with these? Well, complications with rhinoplastic surgery can include bleeding, infection, and asymmetry. Asymmetry means that it's not unusual and not all the time, but occasionally a surgeon may have to go back in and reconstruct the area of the nose because the septum will slip back. The nose may reshape itself in a different form because of scarring. Now, what I tell my patients are, hey, when you wake up, you're going to look better. But it takes a while for a rhinoplastic surgery to reach its final state. And the reason being is that the skin is so closely adhered to the surface of the cartilage that there's no room for swelling. On the abdomen, you can swell like this. On the cheeks, you can swell like this. On the nose, because the skin is so tight, any little bit of swelling will make you look bigger. So I tell them it's like a sine curve. You wake up in the morning and it'll look great. And the next day you wake up and it looks a little bigger, a little not like it did yesterday. And it'll go up and down until it finally reaches its final resting state and the nose takes its final shape. And that can take 6 months, sometimes up to a year. Rhinoplastic surgery doesn't hurt. So after surgery, most patients don't even take pain medications. Occasionally, if the nose is broken, what we will have to do is do what we call osteotomies. In other words, the bone, the little pyramid that gives shape to the tip of the nose, to the top of the nose, has to be broken and reshaped. Even that doesn't hurt. Now, once again, like any plastic surgery procedure, if you're going to have it done, let your physician know what medications you're taking and stop taking any aspirin or Advil or Motrin or anti-inflammatories or herbs or omega-3s that can cause some bleeding after surgery. Because if we see a problem, that's going to be the main thing that we see. It's an outpatient surgery. Within a week, the splint is off and the nasal packing is out, and you should be looking good and looking in the mirror and liking what you see.